Joining us now to talk about it via Skype, Republican strategist Ford O'Connell, and here in studio, Newsmax deputy health editor and author of the Obamacare Survival Guide, Nick Tate. Nick, good to have you in studio. Ford, good to have you there in Washington via Skype. And Ford, I'll begin with you. Speaker Boehner says the president's announcement that he will take executive action on immigration reform is sad and disappointing. The speaker went on to say, in part, quote, "In our conversation last week, I told the president what I've been telling him for months. The American people and their elected officials don't trust him to enforce the law as written." Is the speaker on target with that assessment?
Well, absolutely, the speaker's on target with it, because let's think about this for a second. The comprehensive immigration bill that was before the Senate would not be currently addressing the problem down on the border. And frankly, Speaker Boehner is right to be apprehensive, because he sees what President Obama is trying to do as a trap, basically trying to force immigration down the throats of Americans. And listen, it's a divided Congress, but it's also a divided country on this issue. And if we're going to do this right, we're going to actually have to be able to trust one another. And right now, given what President Obama's done with Obamacare and a host of other items, including the NLRB decision, you just can't trust him. So I don't blame John Boehner, because unfortunately, trying to trust this president and having a bad deal is worse than no deal at all.
There is so much going on here. Nick, we're going to get to the public health implications here. Forgive me, as a recovering member of Congress, the politics kind of dominates this right now. And in terms of the health of the Constitution and the checks and balances, my old colleague, Congressman Lamar Smith of Texas, is warning the president that he could face another lawsuit if the president, in fact, attempts to enact amnesty by executive order. But this situation, if he is to issue that type of executive order, Ford, I have to tell you, I in no way wish for this, but it seems to me the president will have a lot more on his hands than just a, quote, lawsuit. Do you believe this could trigger civil unrest if he were to offer by the stroke of a pen amnesty via executive order?
Well, I think it absolutely would, and we're already seeing this play out right now in the border states. We're talking right now about 50 to potentially 90,000 unaccompanied minors just right now, and it's already targeting unrest in Texas, Florida, and Arizona. And when we're talking about 11 to 15 million people, I can see a lot of folks, particularly working class Americans, being unhappy that the rights of people who came here illegally are trumping their own rights to make a living as we see it right now.
Ford, there's one aspect that I can draw the health analogy on, or a metaphor, and that is taking the temperature of the public, and we'll get to that in just a second. But let me turn to Nick Tate here. Nick, this issue of the illegals coming in, especially the minors, the children, although we understand, according to some published accounts, 80% of these minors are males between the ages of 14 and 18, many of them involved in gangs. We're also seeing a whole lot of talk about health issues, and we got a report of swine flu. There are some other things going on. Can you kind of walk us through the maladies that are coming across the border?
I mean, what we really have here is a potential health crisis, public health crisis. A lot of the kids that come over are not vaccinated in the ways that American children are. A lot of the conditions that they have are things that we have in control in this country, and we're seeing a rise in things like scabies, chickenpox, MRSA, and measles and other things that are largely under control in this country, but because of the poverty and the low quality of health care in Central America and Mexico, the children who are coming over unaccompanied are also bringing those conditions with them. And of course, they pose a huge risk to people like seniors, children in the U.S., and others who have compromised immune systems. So that's really the problem. You know, we spend billions of dollars every year to send CDC officials and other health officials around the world to stop the spread of disease and control outbreaks, and we're really not doing that in this case, and we have an emerging crisis right along the border.
So we essentially are importing, through illegal immigration, third world health problems right now. And when you take a look at the fact that they have moved these minors, in many cases, out of detention centers along the border, flown some to Massachusetts, flown others to the heartland of America, we really are propagating and conceivably aiding in a public health crisis.
Absolutely true. I mean, the places that these children are being held and treated and processed are very crowded. And one thing that we know about opportunistic infections is they spread like wildfire in those very close quarters. And so theoretically, you're putting them in a kind of situation that becomes an incubator for public health problems and then potentially placing them in other places around the country. One other point I'll make, one of the places that Obamacare is silent is in dealing with illegal immigrants. The 12 to 15 million Americans that are already, or non-Americans that are already in America who are undocumented folks are not in any way pulled into the Obamacare plan, but they continue to get care at hospitals, healthcare facilities, and elsewhere. So that's really an issue that has not been addressed. Seems to me that some of the resources that are being thrown at healthcare reform and at global efforts on disease need to be focused on our borders for our safety and security, as well as, frankly, compassionately for some of these kids who, it's not their fault they have resistant TB and hepatitis and scabies and these other diseases they're bringing in.
Let me go back to the acronym of MRSA, because I think for many of us, that has become wow. Now, are they bringing it in? Are they catching it in close quarters? What's the chicken or egg argument on that?
There hasn't been a great deal of study on where the chicken and egg is. It's both. The expectation is the anecdotal reports we're getting from public health facilities and from hospitals along the border is they're seeing spikes in MRSA as well as hepatitis, resistant TB, and other conditions that are really very scary and very frightening, very hard to treat. MRSA is one of those things that drugs really just don't affect. They don't, and it can be very, very serious. So they're bringing them in, they're spreading them in these close quarters, and as I said before, they do spread like wildfire, particularly in these risky populations.
And again, as we heard from the testimony or an interview with one Border Patrol agent, in many cases, the only thing separating the quote sick from the quote healthy is a piece of crime scene tape, a caution tape, a yellow ribbon.
They identify those folks by asking if they feel well. If they say no, they're cordoned off and put in an area, and those who say they're healthy or look healthy are placed in a place that is right next to them, and the only thing separating them is that thin bar of tape. And as we know, microbial pathogens can jump those areas.
There's a reason they're called microbes. You don't see them, and they don't stop for tape.
Right.
Ford, let me return to you, as you've been waiting patiently there via Skype in our nation's capital, to get back to political health. We take temperatures when you're in the hospital with a thermometer. We take the temperature of the public via public opinion polls. Investors Business Daily, with its pollster, went out and interviewed Americans, saying that fully 59% of respondents object to this president's approach to illegal immigration. Now, you and I have been on opposite issues, I think it's safe to say, of the amnesty question. Is it amnesty or is it not? But is it ever going to get through the heads of the consultant class, my friend you included, that people don't want illegal immigration and they view suspiciously any so-called measure that affords forgiveness, amnesty? This is a political loser.
JD, I think you're mischaracterizing my position. I'm saying we need immigration reform. I'm telling you the laws are broken. I'm not saying anything about amnesty or even legal status for that matter. For example, let's just say we had the unaccompanied minors who are Mexican. The Border Patrol can return them in 48 hours and are directed to do so. But the Central American unaccompanied minors we're talking about, guess what? Under the 2008 William Wilberforce Protection Act, they can sit here and languish for several years and months, and at which point they're already going to be indoctrinated in the system. What I'm telling you is, I'm not talking about amnesty. I'm talking about fixing the laws, period. And unfortunately, our laws are broken, even the ones on the book. Technically, when it comes to Central Americans, President Obama is actually enforcing the rule of law. The problem is the rule of law is not able to deal with this type of situation. And it's not only that, JD. Look, of the 11 to 20 million undocumented immigrants here in the United States, believe it or not, only 60% crossed the border illegally. 40% actually overstayed their visas. So we have a lot of antiquated laws on the books, like the William Wilberforce Protection Act for unaccompanied minors, that we have to fix. This isn't just enforcing the rule of law and defending a political loser. All I'm trying to say is we're going to have to do some horse trading in Congress if we're going to fix immigration reform on a bipartisan way.
All right, Ford, I appreciate that.
Might be legal status.
Thanks for clarifying your position on that. Nick Tate, it's good to have you here. And to get more information on what Nick is following, go to healthradarnow.com. You'll get a special offer on the Obamacare Survival Guide, so you want to check that out. You heard our friend Ford revise and extend his remarks. Your take on what's happening on the border, why don't you tweet us your comments at Newsmax TV, #America's Forum. We're coming right back.